We have our good friend in the studio with us right now. Dr. Steffany Mohan from Plaza Dental is here. Time to give you a great smile. Hey. And we're just laughing here because we are looking at boxes of candy that you collected over the past just couple of days, wasn't it?
Yes. Yeah. That I'm not keeping all for myself.
No. Look at all this candy.
Wow. Yeah.
And tell everybody what this is for.
So we do what's called the Halloween candy buyback. What we do is we buy candy back from kids that have gone trick-or-treating and might have a little extra that they don't need, and then we ship it overseas to our troops that are serving for us.
That's got to be 200-300 pounds.
It's 300 pounds.
Is it really?
Yeah. Wow. I know. Isn't that crazy?
That is awesome.
Yeah. So, yeah, I mean, you know, from what we understand, they really appreciate it. And I mean, who wouldn't want to get a big box of candy if you're serving overseas?
And today is National Candy Day, so how appropriate.
It all ties together.
It all ties together. Well, we were laughing during the commercial break because Lou says I'd be handing the candy to kids to make sure you're readily employed for quite some time.
It means I'm a much nicer person than you are.
Everybody knows that.
So. Because you missed the cheat. Ships it overseas.
Because obviously candy can do some damage to your teeth, and we want everyone to have.
What I actually told Lou is that kids don't really need any help getting sugar. You know, and parents are always going, no, I have too much sugar. Please stop giving my kids sugar. You know.
But that's a wonderful thing your office does.
We like it. It's a good thing.
That is great. So what are we talking about here this morning?
Well, today we're going to talk about cosmetic dentistry. So, which is kind of funny because I think it's a cool topic, of course, because it really changes how people perceive themselves and how they feel about themselves, and it's not, to me, it's not a luxury. It's sort of just everybody should have a really nice smile.
Are you talking about having braces, or are you talking about actually rebuilding part of your tooth?
So there's a combination. Cosmetic dentistry today is different than it used to be. It used to be that cosmetic dentistry was veneers. I mean, you know, and you would, you know, paste porcelain over the teeth and make somebody a really nice smile. And that's still possible if everybody has straight teeth and they have, they just have really a nice smile already, but they don't like the appearance of their teeth. So veneers, crowns, implants, or straightening teeth. So those are all kind of options, and sometimes we use a combination of different things just depending on what people need. A lot of research recently has been that a lot of times to straighten teeth, we open up an arch and make it bigger so that the airway also, a lot of people that have very constricted arches, and they have, you know, you see people that you can only see like 3 or 4 of their front teeth, they don't have like a big broad smile. Sometimes that means that their airway is smaller, and then they're at risk of sleep apnea, which can lead to big problems. Really big problems.
The arch being what? What is the arch?
Your upper teeth or your lower teeth. So the arch of teeth.
Okay.
Yeah.
Gotcha.
Yeah. Thanks for asking that. Yeah. Good. Yeah, I know. It's a little bit Latin.
But technology has changed. If people are thinking about doing something to their teeth to create a better smile, it's not what they maybe thought of 10,
well, technology
15 years
has
ago.
changed dramatically because now we have digital solutions. We have ways that we can predict, you know, okay, here's what you look like today. This is what you can look like, you know, 6 months from now or 12 months from now, or however the process will lead. And sometimes it's even like 2 months from now. Sometimes it can be really fast. So depending on what different treatments we combine to make a nice smile.
Yeah, we saw Jackie's when you had yours.
Yep, I had mine straightened, and you had a tooth put in, so we've experienced it ourselves of how
a shiny new tooth.
A shiny new tooth, of how simple it can be and what you can physically do these days.
And one of the beautiful things about dentistry today is it can be much less scary after coming out of Halloween. Dentistry doesn't have to be scary anymore because we have all sorts of different ways that we can take care of people. We can give people anti-anxiety medication before they come in so that they don't feel like their heart's going to be out of their chest when they're having treatment. So there's a lot of things that we can do now that really help people to be very comfortable in the dental chair, which is something that a lot of people never thought that they would be.
Because years ago, people did not go to dentists for years.
Oh yeah, people would white knuckle, you know, yeah, absolutely. And some people still do that, and they don't really know that there are differences in how we can do things. It's a much kinder, gentler thing, which is good for me too, because I don't like it when people come in and say, I hate you.
Yeah. So you had some straightening done with Jackie. You built a tooth for Jason, and years ago, people remember there were 2 people in media in Des Moines that had a big gap in their tooth. Ed Wilson was one of them, and yours truly was another one. And I had a big gap in between my front 2 teeth, and they filled it in, and it has remained from there. Can you see that here? I mean, I could take a pencil and stick a pencil through there. That's how big the...
Wow.
And it really did.
Now you can't
shot.
spit through
No.
there now, though. So.
Yeah.
Yeah.
Well, look, you've mentioned this a number of times on this program. This is the type of thing that can make a huge difference in someone's
It does.
life, self-confidence-wise, and you hate to see it. It even affects their career and
relationships,
it can be a
career,
big deal.
absolutely. Well, I mean, I hate it that the system works that way, but it really does. I mean, and it's really more a product of how we feel about ourselves than it is about what, because everybody knows the goofy guy that you wouldn't call handsome, but everybody loves him. So it's really more about how you feel about yourself than it is about how other people perceive you.
Right.
But it can change the way you feel about yourself, and then it changes the way that other people react to you because your personality, their personalities change.
You see people that will cover their mouth when they laugh.
All the time, yeah. I mean, and people like that. Everybody knows somebody like that that's uncomfortable with their smile, and they know if you're close enough to them, they'll tell you, I don't like to smile because. And people that don't like to smile they're not perceived as friendly or outgoing or somebody that you want to get to know or somebody that you want to spend time with. So,
but there's solutions out there if people think she can't fix this because of my age or it's been like this for so long. Or there are solutions.
Well, there's even like almost instant types of solutions that we have something called snap-on smile, so that if somebody's missing several teeth or they have teeth that they don't like the appearance of, we can literally have a lab fabricate a perfect set of teeth for them. It's temporary, but it's something that they can wear in the interim while they're working on getting their smile back.
So if they don't want to completely go through a major overhaul, there's something they can do for events and things
so
like
we have a lot of patients that will do that first, and just to kind of get their smile back and feel better about themselves, and then we work on the hard work.
Never heard of that.
Yeah, it's pretty cool actually.
That is pretty cool.
Yeah.
Now let's get to the bottom line here. Pricing for some of this stuff. It can be a little pricey. Now, does insurance cover any of this?
A lot of times it does. It depends on what has been done in the past. A lot of times insurance will have sort of a pre-existing condition type of thing that hasn't changed like it has in medicine. But it can be something simple like you had done, which I would consider that to be simple. It was quick and it was painless.
It was very quick,
and can be anywhere from a few $100s to if somebody has to have their entire mouth rebuilt, it's going to be a car. It's going to be it's going to be a big project. It's going to take lots of visits. It's going to take lots of time and lots of materials and lots of labor. So it's
But just ask. That's the important thing.
Just ask. I mean, here's the thing. I don't really know very many people that can't give you. We do free consultations, so people come in and they get a ballpark of what we can do and how we can do it and what it might cost before we charge them anything. So that's something that I think a lot of people are really intimidated by that step, but that's not a difficult step. So some people get to know, they want to just know what they're up against before they really want to move forward. So
it's a great location. They keep you as comfortable as possible, so we highly recommend checking something out for your wellness and your great smile.
There it is. And somewhere there's a bunch of candy right now.
Now would be a good time to visit.
In Dr. Steffany's office.
Yeah.
But there you go. There's how you find Plaza Dental Group. DMSmiles.com to get all the information.
Yeah.
Great job. Thank you.
Thanks. Thank you.